COVID-19. My name is Michael Stewart, communication consultant, and we have a number of persons who will address you and update you today. The media, it is the first time that we are going to attempt to bring the media in by Zoom. So the media would not be necessarily present in our midst, but they will communicate with us through Zoom, and at the right time, they will be able to ask their questions. Just so that we'll have an understanding of how we plan to manage this for efficiency, we are asking the media that they should remain on the purpose of the press briefing so that we'll keep it concentrated on COVID-19 and Tobago's response. Two, if one media house would pose a question and another media house wants to pose a question, we would give preference to the one that has not posed a question as yet before we'll take a second from that media house. Also, what we would do to increase and improve our efficiency is that we are asking that if a question has already been posed and you may have had it as your question, please do not ask the question again so that we could be able to utilize the time as efficiently as possible. We're going to ask you to silence your microphone as we continue. And when you're ready to ask a question, you raise the virtual hand on the Zoom in order to indicate that you would like to have a question. We'll call your name, and you will address your name and your media house when you get in. Okay, so I think that would generally give us the idea of how we're going to go forward. The speakers today, in the order that I would call them, are Dr. Tiffany Hoyt, who is the County Medical Officer of Health, followed by Dr. Roxanne Mitchell. She's the General Manager, Primary Care, followed by Dr. Victor Wheeler, Medical Chief of Staff in the Tobago Regional Health Authority, and Mr. Alan Stewart, Director of the Tobago Emergency Management Agency. And then we'll have our Secretary, Councillor Tracy Davidson Celestine, who is the Secretary for Health, Wellness, and Family Development, and in that order. So once they come forward, they will come in succession. At this time, I want to welcome and invite our first speaker, Dr. Tiffany Hoyt, County Medical Officer of Health.
Hi, and good afternoon to everyone. So I want to provide an update on persons that we have in quarantine and our public health response. So starting on Wednesday, 18th March, we began operating the quarantine facilities here in Tobago, and that was in keeping with the government's policy at that time that all returning nationals, regardless of which country persons had returned from, needed to be quarantined. And we took the extra precaution of putting persons in dedicated quarantine facilities so that we could ensure at all times, 24/7, we know where persons were and that they were not interacting with any other persons. We ensure that they were kept separate and apart as part of our measures to ensure rapid identification if anyone became ill, as well as rapid containment through isolation. So on the 18th of March, we started our first quarantine facility, and then subsequently, we started up a second quarantine facility. At the first quarantine facility, we started with 16 persons being quarantined. Persons at both facilities would have daily medical checkups, daily symptom checks, etc. During the period of quarantine, one of the residents at the quarantine facility developed flu-like symptoms. That person was swabbed and tested, and they were confirmed to have COVID-19. So that was the first recorded confirmed case of COVID-19 in Tobago. That person, as I said, everyone would have been isolated, but that person had 2 travel companions who would have traveled with them from the UK. Subsequently, one of the travel companions also developed flu-like symptoms. Both persons, both the confirmed case and the travel companion who developed flu-like symptoms were tested and subsequently transferred to Trinidad for continued treatment. The third travel companion, because of the level of contact we appreciate that person would have had, we restarted that person's 14-day quarantine period out of an abundance of precaution. So currently, at our first quarantine facility, we have a remainder of 14 from the initial 16 that started. Of the 14 that were there, 2 other persons have been subsequently swabbed. 1 came back negative, 1 is pending, and we expect to get that result by the end of today. Or if all goes well, we expect that the 14-day quarantine period for these persons will actually end tomorrow. And once the quarantine period has come to end and persons have, the remainder of persons, as we said, everyone has been put in self-contained compartments, so they've had no close contacts with anyone, etc. We expect that 2 of these persons are resident in Tobago, and they will be allowed to rejoin their families. The 11 persons who are resident in Trinidad, we will make the travel arrangements for them to return to their families in Trinidad. At our second quarantine facility, we currently have 48 persons at that facility. Now, that facility, persons would have entered at different dates. But we expect that by the first week in April, during the course of that first week, persons will complete their 14-day quarantine. So among the persons we have at the second quarantine facility, 2 persons have developed flu-like symptoms and have subsequently been swabbed, and their test results are pending. But again, because persons have been kept in self-contained compartments and not allowed to intermingle, we know that their contacts have been limited. So currently, we started off with 65. We now have 62 persons currently at the quarantine facilities. Just to note, prior to the 18th of March, persons who would have returned from international travel from the listed countries, at that time, the protocol is that persons were put under self-quarantine at home and monitored by the surveillance staff daily. So of those persons who were placed at self-quarantine, 8 persons were tested, and all of those tests returned negative. Subsequently, all our persons who would have been under self-quarantine have completed their 14 days quarantine. No one has tested positive, and persons have been allowed to be back with their families. So with respect to the total number of tests that have been done in Tobago, we have done a total of 30 swab tests. Of these, we have 3 that were confirmed positive for COVID-19, 5 that are pending results, and 22 that are negative. So of the positive confirmed cases, the first case, as I mentioned previously, was from our first quarantine facility, and that person and one of their close contacts has been transferred to Trinidad for subsequent treatment. Of the second positive case is actually going to be transferred to Trinidad later today for treatment, together with one of that person's close contacts. And the third positive case is being currently stabilized at the Scarborough General Hospital. That person is not fit yet to be transferred. Contact tracing is ongoing for all confirmed cases, and all the primary and secondary contacts of our confirmed cases are being placed in quarantine. So just to note and to re-emphasize that we're asking persons to please stay home and stay safe. The key to containment of this is rapid identification, early isolation, and contact tracing. As part of the rapid identification, aside from the persons that we have at the quarantine facilities or who would have been doing quarantine at home and who we're monitoring closely, we also have the division's hotline, 800-HEAL. So we ask in persons, if you have flu-like symptoms, to use the hotline so you can speak directly with a doctor and be guided accordingly. Also, as part of the rapid isolation, if you have flu-like symptoms, please stay home. Also, once you contact the hotline, you'll be directed to the best area for you to go to get care. For certain persons, based on your symptoms or the history you give to the doctors, we wouldn't want you to take public transport to come to get care at the facilities. We will actually send dedicated transport to you. So we really appeal to persons to use the hotline so we can ensure persons get care in the most appropriate way. And cannot emphasize again that the key is to stay home and stay safe. Thank you.
Thank you.
Good afternoon, everyone. With regard to primary care response, we are ensuring that there is continuity of service throughout the island. Primary care will continue to have a number of its services running. However, we will be suspending a few services. Services to be suspended would include school health services, or outreaches and health fairs, vaccine outreaches, home visits for chronic diseases, as well as our nutrition services. Changes would have been made to our child health clinics, where we will be doing only immunizations, and a block appointment system will be in effect. You will be called, you will be given a block appointment, a specific period of time to come in so that you can have your immunizations done. Parents and guardians are asked to adhere to the appointment times given. Postnatal clinics will continue. In a number of cases, we will conduct telephone interviews and clients will be brought in accordingly. Chronic disease clinics or lifestyle clinics will also continue. Persons that are controlled would be given an appointment within the next 6 to 8 months. However, you will be given a prescription and you will be able to collect 2 months worth of medications at any point in time. Poorly controlled clients will be given block appointments, and you will be reviewed by the physician accordingly. Clients are asked again to adhere to your appointment days and times, thereby reducing the number of persons that will be gathering at any clinic at any point in time. Our dental services have been curtailed. We will be doing only extractions as well as medical management for a number of our dental cases. We will not be doing cleanings, so a number of those appointments will be pushed back. PT-INR clinics will continue on a block appointment system. Again, you are asked to adhere to the appointed times given. Antenatal clinics will continue on a block appointment system. Family planning clinics will continue on a block appointment system. The Tobago Health Promotion Clinic would also continue its services, again on a block appointment system. However, new clients will be seen and given an early appointment. Please adhere to your appointment dates. With regard to the specific COVID response, primary care will soon be setting up screening areas where persons with respiratory symptoms can come, whether it's through the hotline or whether you call the facility itself, you can come and we will screen persons in terms of determining whether you need to be swabbed or whether you need to be placed into self-isolation, and you will be turned over to the office of the CMOH for contact tracing as well as monitoring. It is important that the community realize that there is no cure at present for COVID-19. However, there are persons out there that are, out of an abundance of caution, I would like to think, doubling up on supplements and some alternative medicines. I will caution you with regard to this practice. There are persons who are taking a little too much of some of these vitamins or supplements, and that can become toxic. Please be cautious. I understand persons would want to take the vitamin C as well as some other supplements. Please do not overdose. You are to take according to the directions on these supplements. We need to emphasize preventative measures. We have been saying this from the beginning. With regard to hand hygiene, wash your hands with soap and water. you are to ensure that you wash your hands for at least 20 seconds. There are a number of guides with regard to how you're to wash your hands. On the outside of a number of buildings, a number of places of work, you'll see that they have set up a number of sinks with soap. Please use the soap and water and wash your hands. If soap and water is not available, you can then use the hand sanitizers. You are to use sufficient hand sanitizer so that the hand is wet, and you are to wash your hands again for about 20 seconds. Allow your hand to air dry, and you are cautioned to ensure you wash your hands when you enter a building, when you leave a building. Respiratory etiquette, you are to cover your coughs and sneezes. If it is you are wearing a mask, because we've noted a number of you are wearing masks, please do not remove the mask to cough into the air. Your mask is on to help to protect you from others and to protect others from you. All right, it is a two-way street. If you have the mask on, you can cough into your mask. Please do not remove the mask to cough into the public. Social distancing, you are asked to stay about 3 to 6 feet away from persons. We have noted that at the outside of a number of business places, persons are congregating. Yes, I understand, and yes, the group understands that you do need to access some of these services, but please keep 3 to 6 feet away from persons. As much as possible, we advise that you stay at home. And it is not a matter of staying at home and congregating at home. You are still to try and ensure that you have social distancing at home as well. It is to keep you safe from the virus and from spreading the virus. The country as a whole has implemented a wide range of restrictions with regard to movement. This does not mean that we congregate in social gatherings. You are not to gather more than 5 persons in the non-essential setting. Please do not congregate. If you have to go out, maintain your social distancing. Just to cap everything together, we are advising you stay at home, you stay safe, and you save lives. Thank you.
Good afternoon, ladies and gentlemen. I'll just give a brief update of the hospital services. First of all, Dr. Hoyt had mentioned that the 3rd patient that was tested positive is currently being stabilized on the medical ward of the hospital, and that is part of our efforts to manage with this patient. We've had to make some adjustments to the hospital as a result, and we've instituted a no visiting policy for the medical ward. And I hope that you bear with us during this time. There'll be no visiting on the medical ward. We've also made some adjustments to the accident and emergency department, where we are in the final stages of setting up a separate area to screen, assess, and manage those patients who are suspected of being COVID-19 positive. This way, we will have a totally separate area of the accident and emergency department that will allow other patients who access the accident and emergency department from not being in any contact with any person who is suspected of this. This area is totally self-contained with its own toilet facilities, and we should be fully operational with that by tomorrow. We've already made some adjustments to the outpatient clinic due to the travel restrictions, where we have reduced the number. Certain clinics that are not critical at this point in time have been canceled. Those clinics that require the doctors coming from Trinidad, because there's limited travel, those have been reduced. We've instituted no elective surgery at this point in time. We are only operating on patients in an emergency basis. And we just want you to be just mindful with what is taking place now. You would see certain physical adjustments at the hospital. We will be putting up signs to direct you where to go. just be mindful to facilitate, assist, cooperate with the security services when they try to direct you into areas that you can go and areas that you can't go. It is important in this time of public health crisis that we all remain calm. The patients that are coming to the hospital are getting the appropriate care that they can get. We do have facilities to ventilate patients as we are doing now. We have additional ventilatory capacity in the event we need to ventilate further patients. In view of the increasing number of patients that are positive, we are creating additional capacity right now in the hospital to be able to stabilize and do initial management of patients while we arrange transport for them in Trinidad. Our policy has been, and it still remains, persons who are COVID positive and stable, we will be able to isolate you. Persons who are COVID positive and ill, we'll be able to make arrangement to transfer to Trinidad. But not every person who needs medical treatment will be able to transfer straight away. Some of them would need to be stabilized, as is the case now. And just to close off for now, the message is stay home, stay safe, so that we save lives.
Ladies and gentlemen, good afternoon. Boys and girls, wherever you may be at this time, at home, hopefully, good afternoon. It's my responsibility to give you an overview as to where we are at TIMA. Firstly, let me just mention that our mission is one that we coordinate a network of agencies and individuals whereby we direct their efforts towards the maximum preservation of life and also that of property. In this case, COVID is one that we are paying particular attention to, and our resources have been mobilized to do just that. Allow me to mention the infrastructure. To date, we have allowed some of our assets to be mobilized, speaking about our portable isolation containment system. So that is now mobilized and are ready for use. Also, may I mention that we play a very significant role in the logistics as it relates to the movement of patients, as it relates to the international, to the understanding that we have on a national level as it relates to moving these patients to Trinidad as called upon. So we coordinate in that effect, and that has been going quite well so far. As it relates to the planning activities, we are heavily engaged in planning, doing forecasting, looking at the activities along the roads as to what are the probabilities. And I'm very pleased to be part of this very strong team of planners whereby we can look at all angles and all possibilities and the probabilities going forward. So I just want to continue to give the Tobago public and the wider public that, we are in this for the long haul and we are quite prepared going forward. And I want to thank you very much for your cooperation over the time. I want to thank you very much. Continue to be safe, stay at home, and allow yourself to save lives. Thank you.
Thank you very much. And for those who are just joining us, I just want to remind you that you are listening to an update from Tobago, the health sector, Division of Health, Wellness, and Family Development as to our response to COVID-19. And now we want to invite the Secretary for Health, Wellness, and Family Development, Councillor Tracy Davidson Celestine.
Thank you very much, Mr. Michael Stewart, and good afternoon to the members of the media, and of course to the listening public, and to all of our support team, all members of the COVID task force. And what we are attempting to do, or what we have been doing, is trying to ensure that we provide the information, the correct information to the public so that you can make informed decisions. At the Division of Health, Wellness and Family Development, including the TRHA, and the COVID team, we have been trying throughout this crisis to ensure that we preserve our lives as much as is possible. And as we continue to talk to you, we have been indicating that our attempt in this regard is to flatten the curve as much as is possible. And so, along with the support of central government, we have been trying to ensure that we implement the necessary measures which will minimize, which will mitigate, which will hopefully reduce the transmission of COVID in Tobago and throughout Trinidad and Tobago. But one of the things that has been repeatedly said over and over is that even though we might have the systems, the working of the system, the effectiveness of the system is all dependent on you, the individuals within the respective communities. I heard it from Dr. Mitchell, and I've also observed that persons are still congregating outside of supermarkets, persons are still congregating outside of banks, and the persons are taking this 2-week stay to mean that we should lime and we should bust a cook somewhere. I am using this opportunity to ask you to stay at home. That has been the message. We are asking you, if you stay at home, that you will prevent the spread of the virus as soon as is possible. I want to ensure that Trinidad and Tobago, and even Tobago in this particular instance, can resume to normal activities. But for that to happen, it is all dependent on you, the individuals, within the respective communities at this point in time. I know that there is some anxiety, there is some level of panic out there in the public domain. The statistics are quite depressing, and sometimes what we see on the social media, whether it's YouTube, CNN, BBC, sometimes I have to ask myself what is going on. But we in the Division of Health, Wellness, and Family Development will ensure that we provide the necessary support as much as is possible. And for the last week or so, we have been undertaking, utilizing the services of our mental health officers and even our psychologists so that they can share information with you so as to minimize and to reduce the level of panic and the level of anxiety that we all face at this point in time. I want to indicate that as the Tobago House of Assembly, we have put aside $53 million to fight COVID and to ensure that we are able to treat with any outstanding bills at the TRHA and to ensure that we are able to procure the services, the equipment, whatever is needed for us to fight this fight that we are all engaged in as individuals and communities and residents of Tobago. Representation, of course, was made to central government, and they have acceded to our request, and to date, we have just about $53 million to help us in that fight with COVID. I know that there has been some noise in the public domain about the relationship between central government and the Tobago House of Assembly in treating with COVID, but I want to give you, the members of the public, the assurance that whenever we request any additional support, whether it be from the Ministry of Health or even central government, we are able to obtain, where necessary, that support. And so we have received financial support. We have been receiving the kind of equipment, the PPEs for the doctors and for the nurses to undertake their job. And we continue to ensure that we have that collaboration in order to treat with your particular situation. At this point in time, I really want to congratulate the team for their relentless efforts. As Mr. Stewart would have pointed out, this situation is a highly fluid one. New information comes to hand daily, and as the information comes to hand, we plan and we execute. Sometimes we execute and then plan, because that is the nature of the situation. What we are attempting to do is to ensure that our facilities are not overwhelmed, that our hospital isn't overwhelmed. And in order to do that, we have identified different facilities throughout Tobago. As I would have indicated to you, we have our quarantine facilities. We have facilities up at Fort King George. And as advised by our medical team, the hospital can easily provide isolation facilities because of how it is constructed. But at this point in time, we want to minimize any such activity at the hospital. But there are still persons who would go to the hospital exhibiting flu-like symptoms. And as Dr. Wheeler would have pointed out, we have since set up a tent which can deal, a dedicated space rather, which can deal with those persons. To the nurses, to the doctors who are in the front line at this point in time, we know there is some panic, we know there is some concern, because we know the situation. And I want to give you the assurance that along with the team, I have been listening to all of the concerns. I have been there leading the team, providing the resources that are needed to ensure that you are protected as much as is possible, because you are frontline people in this regard. And we want to ensure that each and every one of you can go home to your families at the end of the day without any significant challenges. So this team is ensuring that we put the systems in place, that we put the infrastructure in place, and of course, we are very concerned with the well-being of the staff at the hospital, and we will ensure that the appropriate equipment, PPEs, as they would call it in the medical field, are in sufficient stock for all of our nurses and doctors who would interface with suspected cases at this point in time. So I want to give you, the members of the public, the assurance that the team is working, we continue to plan and execute, and that the supporting infrastructure is there, whether it's finances that we're talking about, whether it's the appropriate PPEs, all of those are in place at this time. As the numbers come to hand, we will look for additional spaces in order to treat with those who are positive and unwell, and those who are positive but not well. But the facilities are there.
Thank you very much, Madam Secretary. And now, for those media houses that may have logged in late, let me just repeat the principles of engagement. We are going to have you on the Zoom. You can do so by the Zoom, and the invitation for today had a telephone number that you could send by WhatsApp. We ask you to remain on point. We are dealing with COVID-19 as it relates to Tobago's response. We are also asking that if you have posed a question, we will give preference to another media house that would not have posed one as yet before we come back to someone who has asked. We ask you, when you log in, to identify yourself and your media house. Use the raised hand on the Zoom, the virtual raised hand on the Zoom, to show that you desire to ask a question. If you are having difficulty, then you can just signal to us. Silence your microphone once you are not addressing the audience. And also, if a question has been asked already and you had in mind to ask a question, we ask you, please do not ask the question once it has been answered, either because somebody else would have asked. So now we open up the lines for the media houses.
Hi, I don't know if you're hearing me.
Yes, TV6, Elizabeth Williams.
Hi, good day. Elizabeth Williams from CCN TV6. What I wanted to know is, in terms of patient 3, the last person that contracted COVID-19 in Tobago, was this person on the open ward of the Scarborough Hospital before being found positive?
Yes, there was a brief period of time when the patient was being cared for on the open ward, and then that person was moved to an isolation area.
Okay, in terms of that same patient, is it that doctors and nurses who might have gotten into contact with this patient, have they been quarantined? I know the Minister of Health would have indicated that some persons have been quarantined thus far, but are those medical practitioners quarantined at this time?
Right. The persons who had close contact with the patient have been isolated. Self-isolation is really what we do. And persons that the ones with close contact have been monitoring to see if they develop
So
any
Wheeler,
symptoms.
Dr. Wheeler, would you be able to tell me exactly how many people are quarantined in terms of medical personnel?
At this point in time, we are still going through the contact tracing with public health to determine exactly the close contacts, who are primary contacts, secondary contacts. So we have not completed that assessment yet.
What we have been told is a number of EMTs contacted us today stating that they are operating without sufficient PPEs. Would you be able to tell us if how this can be corrected?
You said EMTs, that's the persons who drive the ambulance,
Emergency
EMTs?
medical technicians, yes. They
Yes.
are complaining that they have not been given the appropriate PPEs.
Right.
And they are frontline persons responding to calls. They are saying they have not been provided with the appropriate PPEs.
What I can say is that it is not the intention to give every health worker a package of PPEs. Health workers are provided with PPEs when they are going to be exposed or possibly exposed to suspected patients. That's a policy that is being adopted. It is actually not possible to provide every health worker with their own personal supply of PPE.
Previous press conference, you would have said, Dr. Wheeler, or I think Dr. Ian Sami, head of accident and emergency, that contract tracing for patients, for patient 2 is being done. Could you tell me, in terms of contact tracing for patient number 2 who tested positive for COVID-19, how successful has this been?
So the contact tracing is ongoing currently for both patients 2 and 3. Currently, all primary and secondary contacts are being quarantined. So for patient number 2, we have 24 primary contacts who have been quarantined so far and 31 secondary contacts. For patient number 3, we have 26 primary contacts who would have been quarantined thus far and 5 secondary contacts. Now, that number is going to increase as we continue the contact tracing. And just to state, it includes family members, some of who are also, and healthcare workers. But it's an ongoing process.
Okay, I don't want to hog the mic, so I will just ask one more question. I know TEMA's director, Mr. Alan Stewart, would have stated that the portable containment system, the portable containment unit is available right now for persons to be contained. Could you tell me how many people will be able to be contained in this unit?
While we leave that to the health providers, the facility itself was designed to utilize or to provide for 12 persons. However, based on the present risk that we are dealing with, the particular hazard, COVID-19, it is our best approach based on their protocols that we utilize it for 4 persons and to allow for the necessary spacing. So that is the standard that they have set, and we have tried to facilitate that.
Just one other final question. I don't know if this could be in terms of a quarantined patient who is at one of the facilities of the Tobago House of Assembly. She's complaining that since she arrived on the island on the 22nd, that only on Sunday after she complained, her sheets were changed. Is it that there is regular monitoring by doctors and nurses of patients, and how often will their rooms be checked?
So please remember, because we want persons at the quarantine facilities not to have contact with anyone, everyone is in their self-contained apartment, so there is no housekeeping service provided. Persons were given the necessary stuff to do their own housekeeping. Maybe that person was not aware that sheets are provided on request because there's a fully stocked room of sheets and towels. So unfortunately, she may not have been aware that she had to request it, and upon request, it is readily provided.
Thank you very much. We now go to Cassandra Thompson-Forbes of Guardian Media.
Contract tracing for patients. Good afternoon to the panel. Are you all hearing me?
Yes, Mr. Forbes.
All right. So this question is for Secretary. You indicated that there is a $53 million allocation to fight the COVID-19. Is this an additional amount of money, or does that come out of the Division of Health's annual allocation?
No, this represents 50 million additional and 3 million from the Division of Health and Wellness allocation.
Thank you. My additional question is, Dr. Wheeler indicated that visitation would be, there will be no visitation on the medical ward. Does that include or extend it to other wards of the hospital at this time?
At this time, no. It's just the medical ward. There's actually going to be a physical barrier put up to prevent persons from going down. The rest of the hospital, we introduced a one visitor policy from last week. One visitor per patient policy from last week.
Okay. In relation to the PPEs, and I think Dr. Hoyt might be the best person to answer, can you give us an outline or an idea as to how long does these PPEs last? I know some of them have, some expiration time, whether it may be an hour, half an hour, as the case may be. Can you give us an idea how that works out? And in addition to that, can you also indicate if these times or timings are being adhered to at the Skyway General Hospital?
I think what you're referring to in particular may be the surgical mask or your mask, because once it's like, say if someone is actively coughing or sneezing and we say once the mask is wet, you remove it and replace it with a new one. Other than that, there isn't a time period as per hour, etc. for the expiration. So again, if your mask gets wet, they need to be replaced.
How about the coveralls or the aprons, as the case may be?
Well, if you do a procedure and it becomes soiled, clearly for your protection and the protection of the other persons you're going to attend to, you will remove it safely, do your hand hygiene, and replace it with a clean coverall. So there isn't a set time, it's based on if it becomes soiled.
In addition to that, I believe, and I think many of my other media personnel would agree with me, we are not getting enough information because the persons are asking. Many medical staff would have come in contact with patient number 2 and now patient number 3. You all are telling us in Tobago that self-monitoring is being done. But the ministry is also saying that there are persons who are quarantined. We are a bit confused as to the process because we're getting one thing from the ministry and one thing from the THE. Can you just zero in on that? And I'm sure if you have people quarantined in a facility or at home, you will have an idea of the number. So can you give us an idea of the number of persons who are self-isolating and who are self-monitoring and who are being quarantined either by self or in a facility? And this is only in relation to the medical personnel of patient number 2 and patient number 3.
Okay, so let me clarify. So actually both things are ongoing. So as part of the extensive preparations that were ongoing before we got any confirmed cases, one of it was the preparation of a policy for healthcare workers, because we recognize that healthcare workers are on the front line, that they are going to be exposed, and the ministry would have put a policy in place. So what that policy says is that if you have healthcare workers who have been exposed to a confirmed case, as we have had happen, There are two lines of action that are taken. Assessment is done, and those who are assessed to have had close contact with the confirmed case, those persons will be quarantined. Now, just to say, it would be those persons and their families, because if you had contact and you would have gone home to your family, you yourself, as the primary contact, and your family will be quarantined. For the other healthcare workers who would have also been operating in the space, but their level of contact would not have been as close, so their risk assessment is that they were at a lower risk of being in close contact with the confirmed case. Those persons are put on a strict self-monitoring regime, and they wear PPEs and they continue to work. So actually both lines of actions are ongoing. So for the second case, now the numbers I'm giving you would include not just the healthcare workers, it would also include their close contacts at home, etc. So for the second case, the number of primary contacts, the persons who had direct contact with that case who are currently on quarantine at 24, the number of secondary contacts, so that's the contacts of that person's contact, 31. And for the third case, the number of primary contacts who are currently on quarantine is 26, and the number of secondary contacts is 5. But like I've said, the contact tracing is ongoing, and those numbers are going to increase.
Okay.
Thank you.
I have just two additional questions. Just two additional questions. I'll make them quick. We have been getting information from the dialysis section, and they're indicating that they have no masks or gloves. Can you indicate when they would be replenished, please? Because, these are high-risk patients and persons who would be in contact with these persons, for nurses and doctors.
Let me answer that question to say that there is a system established at the hospital and supported by the TRHA for dealing with issues affecting staff. One of the things I've always encouraged all of the heads to do, the chief of staff is here, is to ensure that throughout this process and even after, that meetings are held very regularly with staff so that we can treat with issues, we can treat with concerns, we can provide the necessary education and also ensure that they have the appropriate equipment to do their jobs. So I would think that if there are members of staff within the dialysis unit who would express those concerns, that they should also bring those concerns to the table when meetings are held with their respective heads. And I've been told since then that meetings are ongoing, meetings have been held with many different sections at the hospital, and I think even outside when we're dealing with primary care. So those meetings are ongoing. And as we sat here, I got a message from the chairman of the TRHA indicating that there was a recently held meeting with the EMTs. The meeting was held by the CEO and the person responsible for infection control, and so they also have given out the appropriate PPEs to those persons who operate the ambulance. But one of the things that I need to emphasize in this process going forward is that if there are concerns by the members of staff, they are to indicate to their respective heads what those concerns are, and the heads of staff will address the concerns as much as is possible.
And my final question, my newsroom got information in regards to a high-risk patient who called the hotline indicating that they had a high fever, breathing problems, all the signs or maybe symptoms of, flu-like symptoms. And they were told on the other end from the hotline that they should make a recovery in 14 days. No one was sent to the house to pick them up. And they are still in the state of feeling unwell. We are asked to put out the information of calling the hotline 800-HEAL. But persons believe when they call the hotline, they don't get the response that they expect to get when they call.
can you just give us an idea as to the protocol? Because we want people to adhere to the protocol. But the doctors or nurses on the other end doing same? Can you just give us a feedback on that, please?
So with respect to the hotline, let me say that it is our senior doctors who are fielding the calls on the hotline. There was a decision matrix, a protocol that was developed for how persons are treated. So persons are divided based on whether you're high risk or low risk. So that's the first thing. If you're someone who's elderly or you have pre-existing medical conditions or you're immunocompromised in any way, the way that you will, the advice you'd be given to get into the healthcare system would be different from, let's say, someone who is low risk. So a thorough history is done. Based on the history, all high-risk persons will be brought into the healthcare system for assessment. So whether you're brought into the health centers, the primary care facilities, or the hospital will be determined by the doctor, again, based on your history. For persons who are deemed low risk, again, based on the history when they have the interview by the doctor over the phone, persons who have symptoms that can be treated at home, and I'm not sure with respect to the symptoms you described, but again, based on the interview, the doctors may advise for persons to isolate at home and advise them whether they are to take a multi-symptom cold formula, antipyretic for the fever, etc. Or, again, if they are to someone who has severe symptoms, even if they are low risk, will be brought into the health facilities. So there is thorough protocols for how persons are advised and even for how persons are brought into the healthcare system. If, based on the interview process, the person's a suspected case of COVID-19, we won't want that person taking public transport and exposing other members of the public. So such persons would be advised to stay home and arrangements will be made for them to be picked up by dedicated ambulance service. So there's processes, protocols that are followed for what advice persons are given based on an interview by the senior doctors.
Okay. Let me just give a question that came in, and it probably came from somebody working in the health sector. And they said, for those who were in close contact with patient number 3, they were told by the CMH that they would be getting in contact with them to determine the risk level, and they are waiting. So they wanted to get a response as to how soon they'll be contacted.
So, like I said, contact tracing is ongoing. It's a number of persons. So persons could be contacted right now as we're speaking, because it literally is ongoing as we speak. And this is not something we've taken the holiday or the weekend to stop. We have been going Sunday to Sunday through holidays and weekends.
Okay, Mr. Akinlabi, holder of Tobago Channel 5.
Good afternoon. Can you hear me?
Yes, sir.
Okay, I want to just circle back to the PPE secretary. We spoke about the PPE being made available to all the medical staff as much as possible, right? Last week, we would have asked you about the quantity of PPE we have, and you told us enough. But I was wondering, if you didn't say it already because the audio was bad, can you give us a figure of how much we have as the central government has been doing?
We don't have the numbers here at this present moment, but I'm positive that on our next session where we educate the public, we will provide you with that information. Because I know at one of the press conferences, the information was put out in terms of the PPE, so we will bring back the information to remind the public.
Okay. Also concerning the Dr. Wheeler, this is for you. Concerning the patient number 3 that was briefly on was it the adult medical ward?
Yes, he's still in the medical ward.
Okay. Were other patients evacuated from that ward?
No, patients weren't evacuated. What we are doing is the ward is divided into 2 halves. So the half where the patient is, we are moving patients from that side onto the other half in our efforts to slowly but surely reduce the number of total patients that will be staying on that ward.
Okay, so you move the patients from one half to the other half. The patients that were on the half with the patient number 3, is there a possibility that they may have become infected?
The patient, right now, the patient was only in the main ward for about 12 hours. And that was on the weekend. When the person developed symptoms, they were isolated. And the area that they are being ventilated now is a separate area from the rest of the patients. And remember, the virus itself, even though it's, once you have 3 feet spacing between patients, which is normally the case on the medical ward, there's very little chance of those other patients being affected by the patient that we currently have there. Remember, this is a medical ward where you have patients with various types of medical conditions, and we do exercise the proper spacing in between patients for that, not just for COVID, but for other infectious conditions that we currently treat.
Okay, so the nurses and doctors that would have attended to that patient during that 12-hour span, did they attend to other patients on that same ward, or did that patient have had a separate team of doctors and nurses?
Yes. Well, no, as part of the contact tracing that is being done by the CMOH office, all of that information is being gathered, and it is ongoing, it is a continuous exercise.
Okay, one more question, and this one is for, I can't remember who would have spoken to it, but concerning the contact tracing for the medical, I think it was the second patient. Someone asked earlier, one of my colleagues asked if you have a number of doctors and nurses that are in quarantine right now, whether it be self-quarantine or whatever. And they said that the process was not completed as yet. But so far, without the process being completed, can you give us a number so far of how many have been quarantined?
So as I mentioned previously, the numbers I'm giving is not only going to include the healthcare workers, but with respect to the second case, the number of primary contacts that have been quarantined are 24, and the number of secondary contacts, meaning contacts of those contacts that have been quarantined, is 31.
You can't give me a specific number for healthcare workers.
I could provide a later date, but the number I'm giving you is an aggregate of both the healthcare workers and the other contacts.
Okay, this is a question for Dr. Hoyt. Dr. Hoyt, is your office for public health workers, is it fully complemented? The staffing.
So the staffing needs to be increased as the situation evolves, and that is being addressed. So as more persons as we have more cases, we're going to have more contacts, and we're going to need more contact tracers, and that is coming on board.
Because I've noticed that in as many press conferences that they're having, you are the only person representing your office speaking, and whenever you can't be there, there's no one from the public health sector there. So is there anyone else besides yourself, if you are not available, that is competent enough to speak on the ever-developing situation?
Yes, so let me just assure you, my staff are very, very dedicated. I'm telling you, Sunday to Sunday, and extremely competent. And the contact tracing is done by a section of our staff, the surveillance unit headed by our epidemiology officer, Ms. Smith. So there's persons who are assigned to certain tasks. We have persons who will run the quarantine centers, etc. So there is a division of labor to ensure that things can be done simultaneously.
All right, thank you very much. That's it from me.
Thank you very much. Vern Extavor, Street 91.9 FM.
Hello, good afternoon, everybody. Vern here. Just one quick question. I've been trying to get an answer to this question, just in terms of the travel gaps that we would have needed to get filled, because we do recognize that 20,000 people come into Trinidad and Tobago in a 3-day space of time. A number of them may have come to Tobago, and I know we mentioned it at one other conference before, but do you have a number of how many people may have slipped through the cracks if you've been looking at flight manifest after to see who landed from international flights and then made their way to Tobago and somehow didn't manage to state that they had international travel? Do we have any idea what that number looks like?
So I didn't walk with the total number, but I can say that a lot of those persons, through help from various agencies, including the TTPS, have been identified and have been placed on self-quarantine together with their families. But I can get back to you with the exact numbers.
All right, no problem. Thank you. That's it for me.
Is there anyone else who would like to pose a question before we close off?
One more point to make before you close.
Additional question.
Yes, Cassandra Thompson Forbes.
And this question is just piggybacking or going back to patient number 3. I apologize if I missed it, but how long was patient number 3 on the ward before it was realized that he was positive with COVID? And was the patient warded for any unrelated issues for respiratory problems?
Yeah, the patient was on the ward for about 12 hours before he was placed in isolation. And I can't go into any other details regarding the patient because of patient confidentiality issues.
Okay. Liz Williams of TV6, I understand she wants to come back in.
Yes, hi, are you hearing me?
Yes, please.
What I wanted to know, just one question, how many ventilators, I'm not sure if Dr. Wheeler would have stated it already, how many ventilators are at the Scarborough General Hospital?
All right, we have 11 ventilators in total, 4 ventilators in the operating theater. There are 7 ventilators that are available for use currently, and we have made requests and we're in the process of getting at least 4 more. But right now we have a total of 11 ventilators, but 4 of those ventilators are in use in the operating theater. And we would not normally use those ventilators for ventilating patients.
Okay, thank you.
Thank you very much, and we appreciate so much the cooperation of the media. I want to ask and invite our secretary to come back in as we close off.
All right, there are a few points that I wish to make before we close, and that is to say that our COVID-19 social support services, or where you can submit the information, the completed forms for those who were retrenched or terminated and would need financial support for rental assistance grant. The email address is silverlining@gov.tt. And I repeat that again, silverlining@gov.tt, and that is for public and rental assistance. We have been circulating. Pardon? What?
We will post the email up.
Yes, silverlining@gov.tt, and support for employer self-employed persons, support for you.tobago@gov.tt. So I just want to put that information out there that you can fill out. Okay. All right, so it's support for you.tobago@gov.tt. That is the only line that is up, and you can put in your completed application forms via email only. because of course we are following the protocols that were established. I want to reiterate that as we close, that meetings with staff are ongoing. Meetings at TRHA, meetings at the hospital, and all the other supporting services are ongoing with members of staff. And as I would have indicated earlier, if there are any concerns, if there are any recommendations from staff, we are asking you to provide the information to your heads as much as is possible. We have established a structure within the hospital that would provide us with reporting feedback as much as is possible. We have the WhatsApp communication that all of us are part of. So if there are any challenges that would have arisen at any point, we can collectively come up with ideas and solutions almost overnight to treat in with those issues or issue that would arise. I want to indicate that now is really not the time to create panic in the public domain. What we're trying to do as much as it's possible is to provide information, ready information to members of the public. I know some may try to sensationalize the information that is put out there, but we are asking you, especially members of the media, to try not to create panic, because there is some stress, there is some anxiety, there is some concerns within the public domain. I am of the opinion at this point in time that we are in a relatively good place with the treatment or with the dealing with the challenges of COVID. When you look at what is happening in the United States of America, Brooklyn and New York in particular, when you look at what is happening in Italy, we are in a relatively good position when compared to those countries that can easily be classified as first world status. So I want to give you, the members of the public, the assurance that we will plan, we will execute, we will continue to look for facilities where needed. We are responding to the situation, we are responding to the demands as much as is possible, and we will organize when we receive information. But most importantly, we will ensure that you, the members, have the information so that you can make ready decisions. And we have been sharing with you the information over the last month or 3 weeks or so, and now it is time for all of us to act, and act meaning that you must stay home. Stop the congregation, stop the liming, stop gathering outside of the supermarket, stop gathering outside of the banks, because if you don't follow the rules and regulations, we can find ourselves in an overwhelming situation, and at this point, that is what we are trying to prevent.
Thank you very much, and I want to thank all of you, all our viewers, all our media personnel, those who have presented. Councillor Tracy Davidson Celestine, Secretary for Health, Wellness and Family Development, Dr. Tiffany Hoyt, County Medical Officer of Health, Dr. Victor Wheeler, Medical Chief of Staff and the Tobago Regional Health Authority, Dr. Roxanne Mitchell, General Manager, Primary Care, and Mr. Alan Stewart, Director, Tobago Emergency Management Agency. We thank you all so much for being part of this, and let me remind you that if you want information, you can go to the website of the division and also to our Facebook page, and remember to keep calling the hotline in order so that you could get information. So for now, stay home, stay safe, save a life. I'm Michael Stewart on behalf of the Division of Health, Wellness and Family Development, the Tobago House of Assembly, the Tobago Regional Health Authority also. Have a wonderful day now.